All right, Nurse Misty here with some tips and tricks when it comes to the head to toe assessment. Some things to think about when you do your head to toe assessment. You literally are starting at the head. You're just looking for any abnormalities, any variations of what would be considered normal. So looking at the eyes, looking for any redness, crusting, anything like that. Looking at the ears for any external obvious issues, drainage, redness, anything of that sort. When we look in the nose, we're going to be looking for redness, irritation, if there's like a deviated septum, any sores or anything like that. Looking in the mouth, we're looking for white patches on the roof of the mouth, which would be an indicator of thrush. We could be looking at the back of the throat to see if there's redness or swelling or white patches there. We're also looking to see if the mucous membrane is moist or would be an indicator of dehydration. Then we're going to look at the eyes. When you look at the eyes, there are two things that you're trying to do. The first is looking for the pupil reaction. So perla, are the pupils equal? Are they reacting equally? Are they round? And all of those things. So what you're doing is when you have the patient looking straight ahead, you bring the light in from the outside, you bring it in, and as you do that, you should be seeing the pupil dilate and constrict. So as the light goes away, the pupil will dilate. As the light comes in, it will get smaller. And so you want to do that on both sides at least twice to see, are they doing the same thing at the same time? Are the pupils truly equal, round, reactive to light and accommodation? The other aspect of the head to toe assessment with regards to the eyes is the 6 cardinal gazes. When you do the 6 cardinal gazes, you instruct your patient to sit with their face forward, they don't move their head, and they only follow either your pen or your finger with just their eyes. And you're going to move the your pen or whatever it is that they're following. You're going to do a diagonal, then you're going to do a diagonal going the other way, again having them follow with their eyes, and then you're going to go side to side. Okay, side to side. And what we're looking for is like any kind of nystagmus or any variation that the eyes are making major adjustments as they're following your finger. Also, as we're here, we're going to be looking for if they have like any abnormalities in their hair potentially, looking to see if they're flush, if they have any bruises, injuries, or anything of that sort. And then we're going to go down to the neck. So you could feel on their neck if lymph nodes are swollen. You can take your hands on their shoulders and have them raise their shoulders against resistance to see how their shoulders are, also testing to see if their shoulders are equal. And then you're going to do some range of motion, having the patient, if they can do it actively on their own, having them kind of see what movement they can do at their joints. If they're not able to do it, then you're going to take hold and you're going to gently move their arm for them, doing all those motions, trying to see how the muscles are functioning and how the joint functions overall. So that is the start of the head to toe, working from the head, focusing on all of those areas, down the neck, to the shoulders, and through the joints. So that is the first step.